Greetings, everyone, and welcome to today's session of your musculoskeletal system course. I'm Dr. Sally, and today we're going to be discussing or just going through the blood supply of the lower limb. Just keep in mind that this is going to be a session that just includes a lot of information that you've already been through, because you've already taken the different parts of the lower limb. So it should be easy for you guys to follow along with this lecture. So with that said, let's go ahead and get started. Okay, so for this session, what we're going to do is we're going to look at the blood supply of each of the different parts of the lower limb by separately. So we're going to look at the blood supply of the thigh, we're going to go through the blood supply of the gluteal region, and then we're just going to go through the leg and the foot, vessels in those regions, all right? So, starting off with the blood supply of the thigh and the gluteal region. Remember that the thigh is divided into three compartments, and generally each one has its own blood supply. You've got the anterior compartment, which remember was the extensor compartment. It had the quadriceps, and then it had a few extra muscles like the sartorius and the pectineus and so forth. Okay, we've got the posterior compartment, which was the flexor compartment that had the hamstrings. And we had the medial compartment, which was the adductor compartment with the adductor longus, the magnus, the brevis, and so forth. Okay, so what you're looking at here is just a representation of the thigh. Okay, obviously the muscles and soft tissues are not in this picture, so you're just looking at the bones and the blood vessels. Where on earth is my cursor? Ah, there it is. Okay, so generally the femoral artery is the main blood supply or the source of blood supply to the thigh. Um, if you look up here, this part of the artery is called the external iliac artery. This is actually coming as a termination from the abdominal aorta here, divides into two main arteries called the common iliac arteries, and then the common iliacs divide into internal and external. So the external iliac artery is going to pass underneath the inguinal ligament, and once it passes the inguinal ligament, it becomes the femoral artery. So it's the same artery, it just has different names depending on where it is. Okay, so it passes into the thigh as the femoral artery, and then what it does is that the femoral artery gives off a branch from its posterolateral side, and that's called the profunda femoris artery. That's the one that's shown in green here. Okay, and you can see that there's a couple of branches coming out of the profunda femoris. One of them is kind of going to the back of the femoral head and the neck. Another one is curving around the front here. You've got some that are passing to the posterior compartment. You've got ones that are going to the medial side as well. There's a couple of branches here. Okay, and then you'll notice that the femoral artery just kind of continues on its way down the rest of the thigh. So it gives off the profunda femoris, and then it continues down the rest of the thigh until it reaches an opening in the adductor magnus, which is called the adductor hiatus. So the femoral artery is the main source of blood supply to the entire lower limb, and we're going to see why as we go along. But generally, like I said, it enters the thigh as a continuation of the external iliac artery, which passes underneath the inguinal ligament. And then as it descends, so as it's going down, it's supplying the anterior thigh muscle. So it's giving off branches to the anterior thigh as it passes down. 4 centimeters below the inguinal ligament, it gives off the profunda femoris artery. So basically, the anterior compartment of the thigh is supplied by the femoral artery. The profunda femoris artery, which arises from the lateral side of the femoral artery after it enters the thigh, is responsible for giving off a few branches, and then each branch ends up supplying a certain place. Okay, so it gives off something called the medial femoral circumflex artery. That was one of the arteries that you saw curving around. It passes posteriorly to supply the neck and head of the femur. It also gives off the lateral femoral circumflex artery, and that ends up supplying the lateral part of the thigh. So the femoral artery will supply the anterior aspect, and then towards the side, so like maybe in the region of the vastus lateralis, and then towards like the iliotibial tract and so forth, that'll be supplied by the lateral femoral circumflex artery. It also gives off 4 perforating branches, which were the three. Let me just go back for you so you guys can see it. Okay, so these branches here, okay, the ones that are coming out like one after the other, those are the perforating branches, okay? It gives off perforating branches which are technically 3 in number, but we say 4. The first 3 are actual branches that come out of the profunda femoris, and then the 4th one is just a continuation of the artery itself. And these perforating branches supply the posterior compartment and the medial compartment of the thigh. Okay, so you can see here you've got the perforating branches of the profunda femoris. They're passing to the posterior compartments of the thigh. Okay, and then you can't see them here, but there's a couple that are also going to be passing to the medial compartment. And here you've got the adductor hiatus with the femoral artery passing through it. I also want to bring to your attention in this picture the gluteal region. We're not going to get into the blood supply of that region too much because its arteries actually come from the pelvic arteries, not the femoral or the obturator or any other arteries in the lower limb. Okay, but generally you know that the gluteal region has a muscle that passes along its center, which is called the piriformis, and we usually use that as the landmark of the gluteal region. So the piriformis has an artery that passes above it and another one that passes below it. These are our two arteries that pass through the greater sciatic foramen. One of them is called the superior gluteal artery. The other one is called the inferior gluteal artery, depending on their relation to the piriformis. And these two arteries are responsible for supplying the gluteal region. So the gluteal arteries, like I said, the gluteal region is supplied by the gluteal arteries, which are superior and inferior, and they are both branches of the internal iliac artery, which I explained a little bit earlier as being one of the arteries that are found in the pelvis. Okay, keep in mind that even though the medial compartment is supplied by the perforating branches of the profunda femoris, it also receives blood supply from the obturator artery, which again is a branch of the internal iliac. So think of the medial compartment as having 2 sources of blood supply. So to wrap up that section, you've got the femoral artery supplying the anterior thigh, and it gives off the profunda femoris, which gives off perforating branches to the posterior thigh and the medial thigh, and the medial thigh is also supplied by the obturator artery. Okay, so when we come to the blood supply of the leg, remember that the femoral artery descends into the thigh and passes within the adductor canal. And then once it passes through the adductor hiatus, which was that opening in the adductor magnus, it becomes the popliteal artery. So whenever I change or the location of an artery changes, I automatically change its name as well. So it becomes the popliteal artery, and the popliteal artery passes down behind the knee, specifically in the popliteal fossa, and it reaches the leg. It's usually, like I said, found deep in the popliteal fossa, and what it does is that it reaches the lower border of the popliteus muscle, okay, which was one of the muscles found in the posterior compartment of the leg. Once it reaches the lower border, it divides into the anterior tibial artery, which is the smaller branch of the, smaller terminal branch of the popliteal artery. And the anterior tibial artery supplies the anterior leg compartment, and what it does is that it passes in an opening in the interosseous membrane, descends in front of the interosseous membrane, and ends up supplying the anterior leg compartment. The other terminal branch of the popliteal artery is the posterior tibial artery, and is the larger one. It passes deep to the gastrocnemius and soleus and ends up supplying the posterior leg compartment. It also supplies the tibia, and it also supplies the ankle joint. Okay, so we've mentioned the anterior and posterior compartments of the leg, but remember there's a third compartment in the leg, which is the lateral one. So we have an artery called the peroneal artery, and the peroneal artery is actually a branch of the posterior tibial artery because it is the larger of the two terminal branches. So the posterior tibial artery gives off the peroneal artery, and it usually branches off near the origin of that artery. The artery will pass down, so the peroneal artery passes down behind the fibula, and it ends up supplying the lateral compartments of the leg, as well as the fibula itself. And remember, the posterior tibial artery supplied the tibia. Okay? So, this is a picture of the leg. Okay? You can see here that there's and I'm not sure if it's clear, but there's an opening in the interosseous membrane, and then you have the anterior tibial artery passing down in the anterior compartment. And then posteriorly, you've got the popliteal artery here. Okay, it divided into the posterior tibial artery, and that's the posterior tibial artery there. Okay, and that's the anterior tibial artery passing to the anterior compartment. And then this is the peroneal artery, which is also sometimes referred to as the fibular artery. So it's passing to the lateral compartment. You've got the posterior tibial here, passing to the posterior compartment. And there is the anterior tibial artery passing anteriorly. So, that was a lot of arteries. Okay, so let's just recap. You've got the femoral artery passing through the adductor hiatus to become the popliteal artery. And the popliteal artery passes deep in the popliteal fossa and divides into the anterior tibial artery, which supplies the anterior compartments of the leg. And the other branch is the posterior tibial artery, which gives the blood supply to the posterior compartments of the leg. And the posterior tibial artery also gives off the peroneal artery, which supplies the lateral compartment of the leg. Okay, and the last thing we're going to look at is the blood supply of the foot. Remember, the foot is divided into the dorsum of the foot and the sole of the foot. So each one of those is going to have its own blood supply. The posterior tibial artery passes behind the medial malleolus and it passes into the sole of the foot. It divides into two arteries, which are called the medial and lateral plantar arteries, and these end up supplying the sole of the foot on their respective sides. So basically, the medial plantar artery will end up supplying the medial half, or the medial part, and the lateral plantar artery will end up supplying the lateral side. The anterior tibial artery, so that's the blood supply to the sole of the foot. The dorsum of the foot is supplied by something called the dorsalis pedis artery, and this is basically a continuation of the anterior tibial. Okay, so it's just going to pass from the anterior leg into the dorsum, and like I said, you change the name depending on the location, so therefore we're going to change this name to the dorsalis pedis artery. This is the main blood supply to the dorsum of the foot. It gives us something called the arcuate artery, which just basically curves off to the side. It curves off laterally. And then from the arcuate artery, you've got branches going off to the toes. It also gives off something called the first dorsal metatarsal artery, and that ends up supplying the big toe. So the dorsalis pedis itself gives off an arcuate artery laterally that supplies the lateral four toes. And then the first dorsal metatarsal artery supplies the big toe. And it terminates or ends by passing to the sole, so it basically pierces the muscles of the dorsum and then just ends up going down into the sole of the foot, and it anastomoses with the lateral plantar artery, giving you something called the deep plantar arch. Okay? So, this is just a picture showing you the different arteries of the foot. Okay, you've got the posterior tibial artery here, dividing into the medial and lateral plantar arteries, and they're just giving off branches to the sole of the foot and the different parts on their respective sides. You've got the anterior tibial artery here, okay, passing into the dorsalis pedis, You've got the arcuate artery here, giving off branches to the toes. You've got the first dorsal metatarsal. Okay, and then you've got the anastomosis between the sorry, where is it? Yeah, you've got the anastomosis between the dorsalis pedis and the lateral plantar artery. Okay, so in summary, you've got the anterior tibial artery continuing as the dorsalis pedis to supply the dorsum of the foot. You've got the posterior tibial artery dividing into the medial and lateral plantar arteries to supply the sole of the foot, and they communicate through the anastomosis formed by the dorsalis pedis and the lateral plantar arteries in the form of the deep plantar arch. Okay, so one last thing is that, when you move on to your clinical training, hopefully soon, okay, you're going to find out that there are certain diseases, and assuming that you did your cardiovascular system course, so you should know this already, but there are certain diseases that affect the blood vessels and then end up, the arteries specifically, and then end up blocking those arteries. Okay, so one of the things that we do to assess the severity of how much of the artery is blocked and whether the blood supply of the lower limb is still efficient or not is we check for something called the peripheral pulses. Basically, there are certain points in the lower limb where we palpate for the pulses of the main arteries to check if they are still intact. Okay, so it's kind of like when you're checking the radial pulse in the upper limb. Okay, the lower limb also has pulses, and then depending on whether the pulse is, if you can feel it or not, you can say that this artery is patent or it's closed. Okay, so if you want to check where the femoral artery is, so you want to feel the pulse of the femoral artery, you should palpate a location called the mid-inguinal point. This is halfway between the anterior superior iliac spine and the symphysis pubis. So halfway between those two structures, if you place your digits there, you will find the pulsation of the femoral artery. If you want to check for the popliteal artery pulse, you should palpate behind the knee because it's found in the popliteal fossa, but keep in mind that the popliteal artery is deep in its position, so sometimes this might be difficult to find. So you want to check the rest of the pulses first before you say that the popliteal artery is blocked. You can also palpate for the posterior tibial artery, and we do this by checking the region behind the medial malleolus. And then finally, we can check for the dorsalis pedis artery lateral to the tendon of the extensor hallucis longus. Okay, so just feel the tendon of the big toe and then palpate lateral to it in that little space. You're going to find the dorsalis pedis. Hey, I can feel mine. Awesome. Okay, so that is all I have for you guys today. I hope this session was useful, and I still have another video to make for you guys, so I'm gonna run and do that. And in the meantime, as always, I'm available for any questions if you have them, and I will see you guys soon.